So what we see then is that as we undergo life and we experience stress of all different kinds, remember it's not just about psychological but also physical and physiological stress, we tend to lose homeostasis. We lose that ability to control and regulate function to the point where we go from a state of being designed for wellness into dysfunction. And if that loss of homeostasis continues, then eventually we can transition from a state of dysfunction into disease. And this middle zone of dysfunction in between that designed for optimal wellness and that disease category is really where a lot of people like you are actually living with their body chemistry. And these are the people that are typically left behind or slip through the cracks in the medical system because they don't really have diseases that the medical system is designed to treat. And they somewhat present a puzzling picture. They clearly have symptoms, but there's no identifiable problem. And we're going to come back to that concept again in just a little bit when we talk about blood chemistry analysis, why doctors look at you and say, well, everything looks to be normal. The critical thing to understand here is that really when we look at disease, it represents a loss of homeostasis. In fact, when we look at dysfunction or disease, it represents a loss of homeostasis rather than gaining something. And if we can reframe our thinking around this concept, that everything I do for my health and well-being has got to be to maintain homeostasis, then we automatically prevent things like dysfunction and disease from happening. Another principle is that human function, and therefore healing, is predictable and sequential. We all have a basic wiring diagram. We're very ordered in terms of how our different body parts and body systems work together. And in my field, I have a saying that healing comes from above down and from the inside out. And that's kind of old alternative therapy philosophy, but as we learn more about the neuroendocrine immune system and we learn more about cell physiology and how that impacts the global function of the system, then it really starts to make sense to us rather than just being a theoretical idea. So let me break it down in simple terms for you. The concept of healing and health and well-being coming from above down really relates back to the concept of having a master control system. So that master control system of neuroendocrine immunology that controls all human function and physiology really represents an above-down process. And what I mean by that is the healthier your brain and its ability to coordinate and communicate with your hormones and immune system helps to establish an ordered and sequential, well-functioning human body. Now, when we talk about inside out, if we just kind of take metaphysics and spirituality out of the picture for the moment, we can recognize that we're really just a collection of cells. The cells are the basic building blocks of human bodies. So if we take different types of cells and put them together, we actually create different types of tissues. So for example, we have muscle tissue and bone tissue and skin as different types of tissues. And if we take different types of tissues, we can put them together and create glands or organs. So for example, a liver is made out of different types of tissues, or the intestinal system made up different types of glands and organs, which is made up of different types of tissues. And if we take these glands and organs and assemble them together in a sensible fashion, we can create systems. So we have the musculoskeletal system, and we have the reproductive system, and we have the digestive system, and so on. But the reality is when we put all of these systems together, which is made up just of all of those individual building blocks of cells, we create a human being. So to go back to our statement that healing comes from above down and inside out, we can truly say that the critical aspect and the most important part of your healing and your health and well-being is to make sure that your brain, your hormones, and your immune system talk to each other and talk to each other well, and that each individual cell in your body has what it needs to do its job. Because if we have healthy cells, we have healthy people. If we have unhealthy cells, we have unhealthy people. And if we don't have a master control system to coordinate all functions that work together, then we just can't have well-being and we can't have vitality, and we can't heal when something pushes us out of a state of balance or out of a state of homeostasis. And then finally, I want to review a concept that's unfamiliar to most people. In fact, it's unfamiliar to most physicians. This is something that we spend quite a lot of time on in my weekend lectures as I travel around the country and teach physicians about using nutritional medicine in their practice. I just want to say that normal, what's considered normal in the conventional medical world is actually not normal. Normal is common, and it's common to be sick. So let's explore that just a little bit more, because it's a very important principle to get and can often answer the question people ask themselves, like, if my lab tests are normal, why do I still feel sick? So let's take a look at that. When we look at the medical system and the medical thought process itself, they really look at your health and your well-being in one of two ways. You either have a disease or you don't. And that's a very black and white way to look at things. And while that might be easy to teach and easy to learn, it really doesn't reflect the reality of how your body functions. So this concept of normal and this black and white approach is really reflected on your laboratory report. And I mentioned this before, and I'm sure you've seen your own blood test in the past where it lists the test that was run and, of course, your result, and compares that to a normal range. Well, have you ever asked where that normal range comes from? So every lab has a set of normal values to compare your results to. Otherwise, how will we be able to make any type of judgment as to whether or not you're sick or you're well? And if you fall within the normal range, then they consider you normal. And if you fall outside of the normal range, either too high or too low, then they consider that you have a disease. And typically, because of their training, the medical system is going to look at you and say, well, we have a drug or we have a surgery for that. But the scary thing is that the labs define their own normal ranges. And in fact, if you were to compare laboratory reports from several different types of labs, you may very well find 3 or 4 different definitions of what's considered normal. The problem is that this is a disease-based system. That black and white thinking of you either have a disease or you don't really has no focus on wellness. And those are two completely different things. If all you're looking for is disease, that's typically what you're going to find, and you may miss things that don't necessarily fall within a true definition of being well that don't exactly look like what a disease process is either. So let's illustrate that graphically. Here's the medical thought process, and this represents that concept of the normal range from the laboratory reports that we were talking about before. The green zone in between represents the normal range. If your blood test falls in here, then everything is fine. And the red zones on the left and the right represents values that are too high or too low beyond the normal range. And if your test result falls within that area, then of course that's a problem that they can identify. So down here, if you're outside of the normal range, you may be recommended to have some type of drug intervention or perhaps surgery. And if they find you within the green zone, everything is normal, so there's really no action required, and sometimes not even to maintain being in a state of normal, which of course we would consider preventive medicine. What we have here is a representation of what happens when your blood values may fall within the medical normal range, but they're starting to creep a little bit close to that red disease zone. Most of the time what we hear from medical physicians at that point is that, well, we'll wait and see you in 3 months and see what happens. Well, if you understand that in order to get up along that border zone between the green and the red, you've probably lost some degree of homeostasis or some degree of ability to maintain control and coordination. And by definition, if you've lost control of the system and it's starting to deviate towards that disease zone, if you wait for a period of 3 months or 6 months or a year or whatever the case may be, then eventually you're going to lose more homeostasis and you're going to end up in that disease zone and you're going to fall smack dab in the middle of what they consider a disease process. And of course, the medical system has an approach to help you with that. So what we want to do actually is redefine what we consider normal. If we look at the medical definition of disease or no disease, really doesn't make sense and doesn't match human function anyways. Our functional thought process is, yes, we do agree where disease begins and ends. That's not in contention. But we don't agree with this concept of normal and just having a black and white thought process of you have a disease or you don't. What that introduces to us now is a zone of dysfunction. And what that zone of dysfunction represents is the deviation away from true optimal function or true wellness into a state of dysfunction where we're losing homeostasis, but we haven't lost as much control to qualify for disease yet. And hopefully that makes sense to you because it's a critical concept and principle within the whole essential medicine model and paradigm. When we find somebody in the green zone, we want to do everything to keep you there. And again, that's just the essence of preventative medicine. But if we find you in this yellow zone, this zone of dysfunction, we want to take action as early as possible to recover whatever homeostasis you may have lost, to restore function and get you back to the point where your body is controlling and regulating itself the way it was designed to.